Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a GP talking to a patient called Mr. White. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi, Mr. White. How can I help you today?
Hi, doctor. I've been having some issues with my stomach lately. My digestion seems really slow, and after eating I feel full really quickly, even if I haven't had much. I thought it was just indigestion at first, but it's been going on for a few months now.
How long have you been noticing these symptoms?
I'd say around 3 months, but it's gotten worse recently. It started as just feeling overly full, but now I'm also feeling a bit nauseous after meals, and sometimes I've even thrown up.
That sounds uncomfortable. Have you noticed any patterns with what triggers the symptoms? Certain foods, perhaps?
Not really. It seems to happen no matter what I eat, but it's worse after bigger meals. I've tried cutting down on portions, but even small amounts seem to give me trouble. I'm eating much less than I used to, but I still feel bloated and uncomfortable.
I see. Have you lost any weight or noticed any changes in your bowel habits?
Yeah, I've lost a bit of weight, probably because I'm eating less. My bowel movements are a bit irregular now, but I don't have diarrhea or anything like that. Just less frequent.
Have you experienced any other symptoms, like heartburn or pain in your stomach?
There's some discomfort, but it's more of a dull ache, not really sharp pain. And heartburn, yes, occasionally, but not as much as this bloated feeling.
And what about vomiting? You mentioned it happens sometimes. Is that after every meal, or just occasionally?
It's not after every meal, but it's happened maybe 2 or 3 times in the last few weeks. It's usually when I've eaten more than usual, but even then, it wasn't a big portion.
Right, thanks for sharing all of that. Based on what you're telling me, I'm considering a condition called gastroparesis. Have you heard of it?
No, I haven't. What is it?
Gastroparesis is a condition where the stomach takes longer to empty its contents into the small intestine. It can cause symptoms like feeling full quickly, bloating, nausea, and sometimes vomiting, just like you're describing. It can occur for various reasons, but often we see it in people with diabetes or after certain surgeries. Do you have diabetes or any history of abdominal surgery?
No diabetes and no surgeries either. So what causes it?
It's not always clear what triggers it, but it's related to issues with the nerves that control the stomach muscles. In some cases, viral infections or medications can play a role. We'll need to do a few tests to confirm the diagnosis, but from what you've told me, it fits the profile.
Okay, so what's the treatment for it?
Treatment often involves making changes to your diet and sometimes using medications. We usually recommend eating smaller, more frequent meals to help with the bloating and fullness. Avoiding high-fat and high-fiber foods can also make digestion easier. In some cases, We prescribe medications that help the stomach empty more quickly or manage symptoms like nausea. There are also tests we can do, like a gastric emptying study, to see how quickly food is moving through your stomach.
That makes sense. Is this something that can be cured, or is it long-term?
Gastroparesis can be managed, but it's typically a long-term condition. The goal is to reduce your symptoms and improve your quality of life. Some people find that adjusting their diet is enough to keep the symptoms under control, while others may need medication for a longer period. We'll also keep an eye on your weight and nutrition to make sure you're staying healthy.
All right. It's just frustrating because I used to enjoy my meals, and now I feel anxious every time I eat, wondering how it's going to make me feel.
I understand. It can be tough, especially when something you used to enjoy becomes uncomfortable. We'll work together to find the best way to manage this for you. I'll order some tests to confirm gastroparesis, and in the meantime, we can start with some dietary adjustments. I'll give you a guide on foods to avoid and what might help. Does that sound all right?
Yes, that sounds good. I appreciate it.
Of course. And let's follow up after we get the test results so we can discuss the next steps. If the symptoms get worse or you're struggling to keep food down, give us a call right away.
Will do. Thanks, Doctor.
You're welcome. Take care, and I'll see you soon.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mr. Chris. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Chris. I'm Dr. Eva, the ophthalmologist on duty today. I understand you've been experiencing some issues with your eyes. Could you tell me what brought you into the clinic?
Hi, doctor. Yes, my eyes have been really red and painful for the last few days. It started in my left eye, but now both are affected. My vision is also blurry, and it's really hard to keep them open in bright light.
I see. How long ago did the symptoms first appear?
It started about 4 days ago. At first, I thought it was just irritation or maybe allergies, but it's gotten worse since then.
And have you had any discharge or other changes apart from the redness and pain?
Yeah, there's been some discharge, mostly clear, but sometimes it's a bit sticky. In the mornings, my eyes feel kind of crusty, and it's hard to open them.
That sounds uncomfortable. Have you noticed any changes in your vision other than the blurriness?
Yes, I've had trouble seeing clearly, especially in the evening when it's darker. It's like my eyes are foggy. I've also had some sensitivity to light, which has been tough when I'm outside.
Sensitivity to light, or photophobia, is common with eye infections. Let me ask, have you used contact lenses recently or exposed your eyes to any irritants?
Actually, yes, I wear contacts daily, and I'll admit I might have been a little careless with cleaning them. I didn't change the solution for a few days, and sometimes I leave them in for longer than I should.
Contact lens hygiene is definitely important, especially since improper care can lead to infections. Have you had any previous issues with your eyes, like infections or injuries?
Not really. I had conjunctivitis once when I was a kid, but nothing major until now.
That's helpful to know. Based on what you've described, there's a possibility that you have keratitis, which is an inflammation of the cornea, often caused by infection. In your case, it might be related to the contact lens use and improper cleaning, which can introduce bacteria or fungi to the surface of the eye.
Keratitis? I've never heard of that before. How serious is it?
It can range from mild to severe depending on the cause and how quickly it's treated. Since you're experiencing significant discomfort, pain and blurriness, it's important that we address it quickly. In more severe cases, if left untreated, keratitis can lead to scarring of the cornea, which can permanently affect your vision. But if we catch it early and treat it properly, it's usually very manageable.
That sounds pretty worrying. What causes it?
Keratitis can be caused by various things. For people who wear contact lenses, like yourself, bacteria are a common culprit, particularly when lenses aren't cleaned properly or worn for too long. Other causes could include fungal infections, viruses like the herpes simplex virus, or even injury to the eye.
I didn't realize contact lenses could be such a risk. Is there anything I should do to prevent it in the future?
Yes, keeping your lenses clean is essential. You should always use fresh cleaning solution and avoid wearing them overnight unless they're specifically designed for that. It's also important not to swim or shower while wearing lenses, as water can introduce harmful microorganisms to the eye. For now, though, we need to focus on treating your current symptoms.
What does the treatment involve?
We'll start by doing an eye exam and taking a close look at your cornea to confirm the diagnosis. If it's bacterial keratitis, you'll likely need prescription antibiotic eye drops, which are usually quite effective. If we suspect a fungal or viral cause, we might use antifungal or antiviral medications instead. I'd also recommend stopping contact lens use until we get your eyes healed up.
I guess I'll need to switch to glasses for a while then. How long will the treatment take?
Treatment length can vary, but most people start seeing improvements within a few days of using the drops. We'll need to monitor your progress to make sure the infection is clearing up. In some cases, it can take a week or two for the symptoms to fully resolve. We'll also schedule a follow-up to check if your cornea is healing properly.
Okay, I'll do whatever it takes. This pain and sensitivity are really tough to deal with.
I understand. Keratitis can be painful, but we'll get it under control. Along with the drops, you might find it helpful to avoid bright lights and use sunglasses outdoors until the sensitivity improves. Also, make sure to rest your eyes and avoid straining them with screens for the next few days.
I'll definitely do that. Should I be worried about my vision in the long run?
In most cases, as long as treatment is started early, there are no long-term effects. However, if left untreated or if there's a delay in getting the right treatment, keratitis can cause scarring that affects vision.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a neurologist explaining about acute stroke patients. Now read the question.
When it comes to treating acute stroke patients, time is everything. The faster we act, the better the chances of recovery. For example, if we can administer clot-busting drugs within the first 3 hours of a stroke, the likelihood of avoiding long-term damage increases significantly. In some cases, we have up to 4.5 hours, but the earlier, the better. Every minute counts because the brain loses millions of neurons each minute blood flow is restricted. By contrast, in non-urgent cases of stroke risk management, like with patients who have transient ischemic attacks, TIAs, the urgency is lower. But for acute strokes, delays of even 10 to 15 minutes can drastically affect outcomes. This is why we emphasize getting patients to the hospital as quickly as possible and starting treatment right away. Most stroke patients we see tend to be older and have underlying conditions like high blood pressure or diabetes, which put them at higher risk for complications. The critical window for intervention narrows quickly, so making every second count is key to improving recovery outcomes.
Now look at question 26. You hear a nurse briefing a colleague during a shift change. Now read the question.
medications and responding to patient calls. Mrs. Jordan in bed 3, who had a knee replacement surgery, mentioned waiting 30 minutes for pain relief last night. Mr. Lee in bed 8 needed assistance to the bathroom but had to wait as well.
That sounds concerning. Any serious patient safety issues so far?
Not yet, but we're definitely seeing some dissatisfaction from patients. The recovery process could be affected if we don't address this. I think we need to escalate this to management.
I agree.
Meanwhile, can you make sure Mrs. Jordan gets her pain relief on time this evening and follow up with Mr. Lee regarding his mobility needs? Also, we should document these delays and discuss them at the team meeting tomorrow.
Got it. I'll make sure to do that.
Now look at question 27. You hear two colleagues talking about a session. Now read the question.
No, it hasn't. Which is a bit surprising since we made sure all the students were aware of the sessions. We even changed the schedule from 1 4-hour session to 2 shorter, 2-hour sessions, thinking that would fit better with their busy routines. But for some reason, that didn't work either.
The interest in the time management workshops for healthcare students hasn't really taken off. And I don't think the length was the issue. I suspect that once students fully grasp the importance of time management and how it ties into their clinical placements and coursework, we might see a shift in their interest.
Exactly. There's definitely a need for it, even though the students don't seem to recognize that yet.
Now look at question 28. You hear a GP talking to an endocrinologist. Now read the question.
Hello, Dr. Thompson. Do you have a moment? I have a patient I'd like your input on.
Sure, go ahead.
I have a 55-year-old male patient who was diagnosed with prediabetes last year. His blood sugar levels are still in the prediabetic range, and he hasn't shown any signs of complications so far. He's asking if he should be screened for any diabetes-related complications, such as kidney or eye issues. I'm wondering if it's necessary at this point.
Well, current guidelines recommend that people with prediabetes, especially those over 50, should be monitored regularly for early signs of complications. Even without a full diabetes diagnosis, there's an increased risk of complications like retinopathy or nephropathy. If your patient is concerned, it's a good idea to start screening.
Now look at question 29. You hear a dermatologist explaining eczema. Now read the question.
I see that you've been experiencing more frequent eczema flare-ups lately. You've made some positive lifestyle changes, and while diet and stress can influence your skin, it doesn't seem like those are the primary causes here. Eczema is often triggered by external factors like changes in the environment or irritants, but in your case, the most likely explanation is the change in your skincare routine. You mentioned starting a new moisturizer, which contains ingredients that can sometimes aggravate sensitive skin. Additionally, you stopped using the medicated cream that had been helping to control the flare-ups, which could also be contributing to the worsening of your condition.
Now look at question 30. You hear two radiologists discussing imaging options for a pregnant patient with abdominal pain. Now, read the question.
GYN department. They have a 32-year-old pregnant woman, about 20 weeks along, with persistent abdominal pain. They're concerned it could be something serious, and they want to order an abdominal CT to rule out any complications.
Do you think that's the best choice in this case?
I was thinking we should recommend an abdominal ultrasound first, given her pregnancy, to avoid radiation exposure.
Good point. Is there any concern about using ultrasound instead of a CT? I'm thinking in terms of diagnostic accuracy.
Ultrasound sensitivity in pregnant patients is generally good, though not as high as a CT for certain conditions. However, in this case, we could also consider an MRI, which provides excellent detail without the radiation.
Ah, right. MRI would avoid both radiation and contrast risks. But if we don't get a definitive answer from the ultrasound or MRI, what's the plan?
If we can't fully assess the cause of her symptoms with the ultrasound or MRI, we can consider a CT, but only as a last resort if absolutely necessary.
That sounds reasonable. Let's avoid the risks associated with radiation and try the safer options first. Let them know we'll proceed with an ultrasound and MRI, and we'll re-evaluate if needed.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear Dr. Sophie Graham giving a detailed presentation on chronic care management. You now have 90 seconds to read questions.
My name's Dr. Sophie Graham, and I specialize in chronic care management. Today I'm talking about a critical issue in healthcare, ensuring access to quality, coordinated care. Patients with chronic conditions often require services from various providers in different settings, such as hospitals, primary care clinics, and even home-based care. Coordinating this care efficiently is not only beneficial to the patient, but is essential to improving outcomes and reducing healthcare costs. When care isn't well coordinated, patients may end up with duplicative tests, conflicting treatments, or unnecessary hospitalizations, leading to poor health outcomes. One of the biggest barriers to achieving high-quality coordinated care is the fragmentation of healthcare systems. In many cases, different providers work in silos, meaning they don't communicate effectively with one another about the patient's care. This often results in care gaps or unnecessary treatments. Patients with multiple chronic conditions are especially vulnerable to this issue. For example, someone with diabetes, heart disease, and arthritis might see an endocrinologist, a cardiologist, and a rheumatologist. If these specialists don't coordinate their care, the patient might be prescribed conflicting medications, leading to dangerous interactions.
The goal, then, is to move towards integrated care models that encourage collaboration among healthcare providers. These models might include multidisciplinary teams that communicate regularly about the patient's condition and treatment plans. We've seen some success with models that employ case managers, professionals who act as the point of contact for patients and ensure that all providers are on the same page. Case managers can help arrange appointments, manage medications, and keep track of patients' progress. This kind of coordinated approach can significantly reduce hospital admissions and improve patient outcomes. Research has shown that one of the most effective ways to provide coordinated care is through the use of electronic health records, EHRs. EHRs allow all of a patient's healthcare providers to access the same up-to-date information, reducing the likelihood of errors. Despite this, the uptake of EHR systems has been slow in some areas, and even when they are used, the systems may not be compatible with one another. This is a major issue, as patients frequently move between different care settings, such as from hospital to home care, or from a specialist to primary care. Ensuring that each provider has access to the same information is key to a smooth transition. Another important factor in coordinated care is patient education. It's crucial that patients understand their own healthcare needs and how to manage their conditions. This becomes especially important when patients move between different settings, like from a hospital to home care. If they don't understand their medication regimen or follow-up care instructions, they're at risk of ending up back in the hospital. Patient education can be improved through the use of health coaches or nurse educators who work directly with patients to help them understand their care plans and make informed decisions. Family caregivers also play a crucial role in coordinated care. For many chronic care patients, family members are the primary source of support, especially when it comes to managing medications and ensuring follow-up appointments are kept. However, caregivers often report feeling overwhelmed, especially if they aren't included in discussions about the patient's care plan. It's vital that healthcare providers involve family caregivers in the decision-making process and provide them with the resources they need to support their loved one effectively. Community-based support programs can also help by offering respite care or providing caregivers with training on how to manage specific conditions. Finally, I want to emphasize the importance of community-based support networks. Chronic care patients often benefit from services like home health aides, physical therapists, and social workers. These professionals can provide care that allows patients to remain in their homes rather than requiring a hospital or nursing home stay. However, the availability of such services varies widely, and in some cases, patients are unable to access the care they need. Expanding access to community-based care and ensuring that these services are fully integrated into the healthcare system are critical to achieving better outcomes for patients with chronic conditions. In summary, the keys to improving coordinated care are integrating healthcare providers through systems like EHRs, providing adequate patient and caregiver education, and ensuring access to community-based support. By addressing these areas, we can improve care outcomes, reduce hospital readmissions, and ensure that patients with chronic conditions can lead healthier, more independent lives.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Nathaniel Parker. Now, read the questions. You now have 90 seconds to read questions. Good morning, Dr. Nathaniel Parker. It's great to have you here today. I understand you've recently been researching how healthcare professionals can better communicate with patients suffering from cognitive impairments, like dementia or Alzheimer's. Could you share what prompted your interest in this field?
Good morning, and thank you for having me. Yes, my interest in this topic was sparked during a hospital visit when I witnessed firsthand how communication can go wrong with cognitively impaired patients. I was observing the case of a woman in her 70s who had Alzheimer's and was admitted with pneumonia. Despite the medical staff's best efforts, she became quite agitated and confused when they tried to explain her treatment. At one point, she even refused her medication because she couldn't understand the purpose of it. This situation demonstrated to me how crucial it is to adapt our communication methods for patients with cognitive decline.
That sounds like a very difficult situation. How exactly should communication be adapted for these patients?
The key is simplicity. We must break down information into digestible parts and steer clear of complex terms. For instance, instead of saying something like, "This antibiotic will target the bacterial infection in your lungs," a simpler version would be, "This medicine will help you feel better and breathe easier." It's about making sure that the language we use is clear and easy to follow. Additionally, repeating key points is critical since many patients with cognitive impairments struggle with short-term memory. Repetition helps them grasp the information without feeling overwhelmed.
I imagine the hospital environment can make it even more challenging for patients to process information.
Absolutely. Hospitals can be noisy, and patients with cognitive impairments often become easily disoriented or distracted in such environments. That's why it's important to hold one-on-one conversations in quiet, private spaces whenever possible. This allows patients to concentrate on what's being communicated without external disturbances.
You also conducted a survey on communication with patients with cognitive impairments. What did the survey reveal?
Yes, we surveyed patients and their family members across 3 hospital wards, focusing on their experiences of communication during their stay. One of the most positive findings was that patients responded well when visual aids and gestures were used alongside verbal instructions. These nonverbal communication methods seemed to help overcome some of the challenges posed by cognitive decline. However, one area where we received criticism was that staff often seemed rushed during interactions, which made patients and family members feel uncomfortable asking for clarifications.
It sounds like there's a need for both clearer communication and more time spent with patients.
Precisely. The survey highlighted how critical it is to take the time to ensure patients understand their treatment, especially in this vulnerable population. Another finding was that patients preferred interacting with a consistent group of nurses rather than seeing new faces every day. Continuity in care seems to build trust, which in turn improves communication.
Those are very interesting findings, Dr. Parker. Thank you for sharing them with us today. That is the end of Part C. You now have 2 minutes to check your answers.